Hi, my name is Dr. Sarah Connor. I am a board certified family medicine physician. I started at Chase Brexton 15 years ago in 2011. The thing that I enjoy most is coming to a place and working with people that I will call family. There are sometimes days when you are here more than you actually see your own family, and coming and working as a team and taking care of our patients is something that's been a really special experience here for me. My medical assistants, my nurses, we all work very closely together, and whenever I come here, it's a new challenge, and it's a very rewarding job that we do every single day. The opportunity to motivate patients and encourage them to pursue a healthier lifestyle sometimes, being kind of their partner in what they're trying to accomplish to be healthier, or what I try to motivate them and tell them that they need to do, and just working together with them, and then seeing the outcome. That's the part that excites me the most. So one of my favorite, most treasured memories is in 2023, I was honored to be nominated as Provider of the Year. I started here in 2011 right after residency, and at that time I was taking care of patients. I didn't have any leadership roles, and I was okay with that for a while. And then I got an opportunity when the diabetes program started at Columbia to become it was called the Provider Champion. And so I said, let me try this. Let me see Chase Brexton through another experience as, in leadership. And I became the medical director for our diabetes and nutrition program. And it started out a very small program in Columbia, and we were able to expand it to all of our sites. So because of that accomplishment, I was, and probably some other features, I was awarded Provider of the Year in 2023, and I was very honored, and that's probably one of my best memories. One of my other most memorable things at Chase Brexton is around 2015, 2016, we were going through a change, as many organizations do, and working in a community health center can be, have its ups and downs, and this was a down point. And we came together as providers, and we said, we love Chase Brexton, we love the mission, we want to make this, a better place where we feel like we can take care of our patients. And a union was created that I was part of the start of the union in around 2016, and with that we were able to come to some agreements, and we had some representation that we felt that we needed, and it only went up from there. And I'm very proud of being part of that, of when it started. And I think it has accomplished a lot for us and for the organization. And that's one of my favorite memories. So when I started in 2011, I came right out of residency, and this was actually my first time using EMR. I had used paper charts before, so that was my biggest change, and saw how much easier things were. But the other biggest change that I saw in Chase Brexton was during the pandemic in 2020. So when the pandemic came around March, I'm very proud of how Chase Brexton handled everything, the communication, leadership made sure that staff were safe, our patients were safe, and this was the first time that they told us that they were going to introduce and we were going to start telehealth. And I remember getting that announcement and looking at it and saying, how in the world am I supposed to do my job over a video? Because a big part of being a family medicine doctor is the physical exam and having vitals and using all of that into the big picture to make your diagnosis and your plan. So when I saw that announcement, I said, no way. I know that other doctors may do it in other fields, and it wasn't something that was necessarily new, but it was new for us as an organization. And I remember being very scared about it, a little anxious, cautious if this was even going to be successful. And so they rolled it out, and we started it, and now it is part of our, our daily practice. And It was something I remember that I had a very bad attitude at the beginning, and now I see it as so valuable for our patients and something that, that it makes it easier for scheduling for some people who can't get here in person, and the techniques that I've learned how to make diagnosis over telehealth without certain things, I've also fine-tuned that. Things that have stayed the same, one thing that has not changed, and which is why I'm still here 15 years later, is our mission and our drive to serve a community that is in need. And not many places offer a community health center like this, especially in Howard County. We are the only community health center in Howard County, in Columbia. So that has not changed at all. No matter anything, with our scheduling, the pandemic, anything like that, we've always been here for our patients and giving them the best care and access to care that they may not have at other places. So some advice that I will give, and I have given to new colleagues coming into this organization, is to be patient and to use all of your resources. We have so much help here. We have our immediate staff of our medical assistants, our nurses, but then we have staff that helps us, social worker staff. We have access to mental health, dental, our pharmacy. So I always say, Chase Brexton is a one-stop shop. If you get in here, we'll help take care of the rest. So use all of the resources that we have here available for you and for your patients as well. And it can be a little chaotic when you first start out, but just be patient, because in the end it pays off. You will see the impact that you're making with patients. Patients will be happy and healthier. So my hopes for Chase Brexton is I would love to see it expanded to other counties. I think we provide such an amazing service to the community health center and patients that are in need us. So if we could expand to other counties, I would like us to continue to grow, which is happening, by the minute. And personally for our diabetes and nutrition program, we are starting to become a certified diabetes center in 2026. So that's my hope, my personal goal for our program as well. So my favorite color is, if you're not surprised, blue and gold. So when I started, those were the two traditional colors of Chase Brexton, blue and gold, and now we have expanded to all colors. But to me, that represents the stability of our organization. It represents just the comfort, our mission. So those are my two favorite colors.